Hi, my name is Gary Clifton. I live in California. I'm 71 years old, and in the last 6 months, I have gone through prostate surgery and recovery. I want to talk to the guys who this may be happening to them now or about to be, and to the many men that it is surely going to happen, because most men, by the time they're 80, are going to have prostate problems, and many of those are going to be cancer. Okay, so the reason I'm telling you this is that I've come up with a lot of anecdotal things along the way that could be of interest to guys who are going to go through what I have gone through. Not to say it was terrible or anything, but the doctors at any good hospital are going to give you piles of written materials, and there's lots of YouTube videos out there about what goes into having your prostate removed and then post-operation. But a lot of things, there's a number of things along the way that I picked up just through my own observation, in which I passed on to my urologist and to my surgeon, that I think could be a benefit to a lot of guys. And it has mainly to do with comfort, alleviating pain or potential pain, because there's really no consistent pain, chronic pain after an operation. There's nothing like that. But there are things that can give you pain that can be easily alleviated. I'm going to talk about that. I'm also going to talk about after your operation, you're going to have limited control of your bladder, your urinary tract, and later on potentially your bowel movements, particularly if you go in for post-operative radiation, which I have done. I'll mention that at the end here. I'll also talk about how this is going to affect your sex life, and I say that now because that's probably the only reason you're going to pay any attention to this video. Okay, so here's my story. I'm 71, and around when I was about 64, 63, before I went on Medicare at 65, I had a regular GP, general practitioner, and I went in for my yearly PSA, which all men should do, and they should not look at it as somehow they could save money on doing this. You can go to various, what they call cash clinics, that do not accept insurance. You can walk through the door with no prescription, pay them $40, get your total PSA. Okay? And the people who say they don't want to pay that, well, you know, the next time you're down at Denny's with 3 people paying $50 for a breakfast for 3, think about what $40 is. $40 could save your life. $40 could save you a lifetime, or whatever's left of your life. A lot of pain and discomfort. Pay the $40, okay? And then do it at least once a year. If you have orders from your doctor or not, do it, okay? It's like taking care of your teeth. If you don't want to take care of your teeth, then, you know, consign yourself to being miserable the rest of your life and feeling like crap. So anyway, when I was about 63, 64, well, I took my PSA, and it was 2, and then it went to 3, and then over about period about, it went up about 1 point a year, 4 and then 5. Around 5, my GP, who normally they freak out at about 3, about 4 or 5, he sent me to a urologist. The urologist saw it, PSA 5, okay, time for a biopsy. And the biopsy is it's kind of frightening, but there's really nothing to it. What they do is they lay you down on a table, they meaning a nurse who unfortunately is always present. It's nice to have a pretty nurse looking at your hairy butt when somebody sticks something up it, but that just seems to be the way of the medical profession. And as a male, you get to suffer that the same way that females get to suffer pelvic exams. It's just one of the inequities of life. Can't do much about it. In any case, urologist, not a GP, urologist lays you on the table, and he sticks a probe up your rear end, and at the same time he's monitoring on a monitor with ultrasound. That's how they see. There's no camera. And what the biopsy is, they stick this thing up your butt, and I think there's a little bit of anesthesia in there local. But then they do what's called a needle exam, where on the end of this gizmo, which I really don't want to look at, they penetrate the intestinal wall next to your prostate. and they take 5 or 6 little biopsies off of one side and come around to it the other. And there's no feeling except there's like somebody's inside you pinching you, but there's no real pain. And the reason that they can penetrate the intestinal walls is that the intestinal wall doesn't have any nerves. They don't have any pain nerves. So, as you would think it'd be agony doing this, they don't go directly for the prostate. They go through the intestinal wall, and they retrieve these biopsies, which are then sent off to a pathologist. In a few days, your doc is going to get the prognosis. Is there any cancer there or not? In any case, it only takes about 10 minutes, and he withdraws the probe, which isn't bad. It's not, big around as your hand or anything. It's just small. And then he'll give you some paper towels, and for the next 5 minutes, you're going to bleed a little bit from your rectum, and then those will turn into some blood clots. You just wipe yourself off, and after 5 minutes, 10 minutes, if you have normal coagulation, you're going to be dried up. You pull your pants back on, you throw the soiled paper towels into their bio bucket, and you go home. That's it. And when you go home, you may have, in your stools, you may have a bit of residual blood. You actually may have a little bit of blood in your urine, but this all clears up after a matter of days. It's not a big deal. There's no residual discomfort. You may be, a little bit discomfort for a few hours, but it's nothing. It's really not the big deal. Okay, so what happened with me is that at PSA 5, which when I was probably 65, benign, nothing there. So I'm now talking to a urologist all the time. I'm in his care. So every year, with my own nickels, I went in there and I got a PSA, usually 2 to 3 times a year. He didn't have to order it. I just did it. And I had a copy sent automatically from the cash clinic to my urologist, another one to me. And this went on, and what happened is the PSA increased about a point a year. So the point I was up to about at 70 is that my PSA was around 10. Now, the urologist is not terribly worried about the size of the amount of PSA. The way they look at it is this. They look at the trend. See this as a line, okay? And here's your initial PSA, and they just start recording it every 6 months, every year like this. And as long as that line is straight, they're not terribly worried about it. What they're looking for along that trend is a jump, boom, like that, and then going like that. And what happened is that year by year, over a period of 7 to 8 years, my PSA increased to about 10 and a half. And then early this year, March or April, I had another one, and all of a sudden, boom, it went up to 12, just like that. And that's where he said, okay, time for another. That's what he was looking for. This is time for another biopsy. Went in there, and this one came back cancerous. I had prostate cancer. Okay, got to get it out. Now, my urologist, nothing exceptional about him. He's a surgeon 2 days a week. He does lots of prostate stuff. Probably just opens you up and takes it out like the appendix. For your information, nobody goes up your rear end anymore. And to start off with, I'm talking to men. I'm not going to use PR terms, nice politically correct terms. I'm going to talk to you like a man. And sorry, ladies, but anyway, they just make a cut above your pubic bone, go in and get it just like an appendix or something. The problem was, 15 years ago, I had a hernia mesh put in my lower belly. I'm a geologist, and my whole life I've been lifting boxes of rocks and boulders and stuff. And in 2005, I was working in Saudi Arabia, and I developed a hernia. I had 2 hernias in my groin where I had protrusions around my groin, and I had a third one in my navel, which is very common, which you don't see, but of course the surgeons see this. So I could not go to a regular doctor who does laparoscopy. There's lots of laparoscopy guys out there. We can do them not too far from where I am in a city in Reno, Nevada. But because of this mesh, the mesh covers your lower belly. It covers your area of your prostate. The mesh is metal. It's titanium. You can't go through it. You can't go in there with metal scissors or drills and drill a hole through it. There's only a few lapo guys in the country, surgeon, who are skilled enough to go underneath. There's my lower belly here, and here's my mesh. They have to go underneath it and then down or get to it. So lots of guys can go through it if there's no mesh there. That's not a problem, but they had to go underneath. And I found in the Western United States there was only 4 surgeons who were capable of doing this. Now I'm, say, roughly around Reno, Nevada. I'm 4-hour drive from San Francisco. So we found that there was one in Salt Lake City, which is 8 hours to the east. There was one in San Francisco at University of California, a wonderful school. But this guy was busy. There was another guy, Stanford, another one in San Diego. The one thing I did not want to do was have to fly anywhere. I was not going to fly to Salt Lake. I was not going to fly to San Diego. So I took the guy Stanford, reasonably well-known medical school. They're not bad. Anyway, so I was scheduled, and within about 2 weeks, I went over to Stanford Med. Now, I checked in. We got a motel right next door to the campus, thankfully for coronavirus. The motel room, which was normally $750 a day because of its proximity to the medical school, was $99 a day. So we made out like a bandit. And because I really did not want to drive all over town. My wife was with me, of course. Anyway, and so I was in the Stanford Medical School for 24 hours to get my prostate out. I checked in. Well, let me back up. The day before, when I got there, the day before the operation, I had to do the fleets enema, the Mucilex, whatever it is, the ethylene glycol exercise, powder, basically to clean you all out. And all this stuff is sent to you in a packet. It's just like if you've ever had a colonoscopy. The doctors have a third-party service that sends you a packet and with instructions of certain things to clean you out. Okay, I received that too. So I had to do that. I had to take a shower with a antibiotic solution and go in all there nice and clean. Checked into the hospital, went into their new wing, which was built just a year or two ago. Now I'm up on the 6th floor in a room by myself with a window as big as Texas looking off to the hills to the west. Absolutely wonderful. Just wonderful. And so I checked in the morning, and they prepped me all up, and I'm sitting there in the waiting room all dressed in my gown and stuff on a bed, and in comes the doctor, in comes the anesthesiologist, in comes a couple of interns, in comes the assistant anesthesiologist, in comes the head nurse, and they all talk to me like that, make sure that I'm the right guy, that I'm not there for a leg amputation or a heart transplant, things like this. They all ask you if you have any metal implants, and the only one for me was that titanium mesh. What they don't want to find is that you have a big hunk of metal in your head or something, and you get electrocuted on the table. They frown on that. Anyway, so they roll me in there, and underneath is this gigantic spider with arms hanging down. It's really pretty terrifying. And I'm in there only for a few minutes before I'm knocked out. Now, I hadn't been in a hospital for 30 years, okay? So, except for my mesh, my hernia mesh. And they're really pretty slick now because immediately the head nurse there, or one of the assistants in the operating room, connected with my wife by text. She's sitting in the hotel room. She can't come into the hospital because of coronavirus. So they would call her up. And anyway, they text to her and they say, okay, Mr. Clifton has entered the operating room at whatever the hell it was, 12:02 p.m. or something. And then the next one, it says, Mr. Clifton is cracking jokes. Number 3, we knocked the guy out to shut him up. And number 4, we now are initiating the operation. And then about 3.5 hours later, Mr. Clifton has been, the operation been terminated, we're done, and he is now in the recovery room. So my wife knew more about what was going on than I did. Now, I woke up, I keep my eyes closed and, make sure there's no dizziness. Woke up, and I was about 4 o'clock in the afternoon. I think the operation was started at 3. I woke up at, or started at 11 or something, and I woke up at 4. Anyway, just, very shortly after the operation's done, I wake up. And, and I sort of look around, and I get fog out of my head, and I realize I'm famished. Here I was under general anesthesia for hours and hours, and I wake up, and I'm hungry. And I had asked the anesthesiologist, I said, I don't want to wake up sick. Can you, well, anyway, obviously the anesthesiologists have figured it out that you don't have to be waking up, barfing your guts out, which was always the wonderful way of past operations. But it may have to do with my constitution. I'm pretty tough. I can, as they said on Rambo, I can eat food that would make a billy goat puke. Nothing bothers me. No medicines bother me, and I'm pretty fit. So maybe it's because of that. But I woke up, I felt fine, and within 2 hours, I had ordered some light meals from the cafeteria, which was soups and things like that. No pizza, no lasagna, nothing like that. Just simple food, and then eventually went to sleep probably about 9 o'clock at night. All this time, I've got a parade of nurses. Most of them really good looking, and a guy actually who had been transferred over from the cardiac division. There was a shortage, and anyway, these guys are coming in and out, feeding me pills, taking my blood pressure, make sure I'm not going to die, post-operation, and taking very good care of me. And so I'm laying there and figuring out what things, and one of the first things I noticed is that I had no sense that I had to urinate. Now, this should be no surprise because I was told what was the story after I came out, but it's sort of, okay, why can't I urinate? So I felt down there, and all of a sudden I realized, oh, goodness, I have a catheter. Well, I've never had one, and I've always pictured that as probably the ultimate indignity for a man is to have a catheter. Well, here I am. I didn't have to look at it. I could feel I had a tube coming out of my dick, and that passed on to a urine bag that was sitting there flat on the bed under the sheets. Well, somewhere in the early evening, in comes this really attractive young nurse who told me she was Pakistani, but very capable, like all the nurses there, and I had to swing my legs over, and then she just emptied my urine bag, and to make sure that my tube was correct in all of this. Okay, I'm going to talk about this because there's probably a lot more men afraid of wearing a urine bag than they are having their prostate removed, okay? Anyway, I'm going to come back to that for a moment, but what you do realize when you do wake up is that you've got a couple of sore spots on your body, and lifting yourself up, of course they can elevate the bed, electronically, or swinging your legs off, or attempting to walk is pure agony. The reason is because in the laparoscopy they punch 4 or 5 holes through the wall of your abdomen because they can put all the spider arms inside you and work away. Well, when I woke up, I guess they were all pretty sensitive, but there was 2 that were really tender, and they were over on my right side, or like about where my appendix are. Just a few of them. But man, when you tried to move, you're flexing the muscles in your abdominal wall, and man, it was like a knife being punched into you. It was agony, just really sore. You had to be helped to a standing position. You tried to walk hunched over for you're not kind of squeezing on those lesions. That was the only painful part. There was no internal pain or anything like that. It was those damn lesions. And those took a couple of weeks to heal up where they weren't so sensitive. But that's the only pain, at least I dealt with, was those damn lesions. And you had to be careful with those things. And there's some things I'm going to show you to alleviate any potential pain in those things. But anyway, you realize that, first of all, you've got some sores on your gut that are sensitive, and you also are on a catheter. Okay, let me talk about the catheter, which is probably of more interest to men than anything, other than what is going to be my sex life afterwards. But we do this in sequence, okay? The catheter is if you, of course, most men have never had this, is a tube, the initial tube about that long. And they put it up your dick, and it is partially inflated inside your bladder, for it cannot be pulled out. I'm not sure how they do it. It's kind of magical. And on that, and then they tape the lower end to your thigh, just below your crotch. And then the urine bag is a plastic bag, and it's got a tap on the bottom with a loop on it with just a pin that closes. That's how you drain it. But off the top of it, you have another tube which can be 3 feet long, and that hooks onto the one on your thigh. Basically, the one on it's either, here's the one coming down from your thigh, and it pushes in there and held by friction, or vice versa. This one, and then the one on your thigh pushes in this way. I don't know which one, but they'll separate. Okay, and so the urine bag is there, it sits on the bed. As you and what will happen is that since it's into your bladder, there is no sensation that you have to go, because your bladder is emptying spontaneously. Every drop that goes into your bladder spontaneously goes down this tube, makes its way to the bag. So which is nice. In fact, after a few days, you say, this is great. It was just the way God made me. I had some sort of a bag on my thing, for I didn't have to worry about taking a leak. It's all taken care of. Okay, so you learn, first of all, there's no sensation except it might itch a little bit on the end of your dick, but that goes away. And this is what the nurses check. They check to make sure it's clean, that it's not dislodged. But the way it's constructed is that you have a bag over here, you have tubes hanging down, and somehow you trip over them. You don't rip that thing out of your gut, out of your bladder, because then you've got a problem. It would have to be reinserted. You could potentially damage yourself. So instinctually, however pronounced, you watch that urine bag, because you realize you trip over that thing, or you get a caught in the door and you're running out the door, you're in trouble. So you realize to take care of it right away. Now, the thing about urine bags, I have visited friends over the years who have had some surgery or the other. One had stomach cancer, and they run a catheter. And you go to their house, and they're in a wheelchair sitting at their chair, and they've got this gigantic bag of piss hanging off their damn chair. Great big bag of yellow piss. Oblivious to the fact that their wives, their family, their friends don't want to look at this. Nobody wants to see somebody else's big bag of piss, okay? As a matter of propriety, as a matter of courtesy, put the damn bag in something that people don't have to look at it. And I managed that within the next morning when I left the hospital. That's the first thing. The hospital had given me all kinds of goodies, and these were in plastic bags. Just a plastic bag like you would get from a grocery store with the handle on it, white bag. And I had thought about this long before they ever had to go in a catheter. I did not want anybody to see this. It's just not polite. So I just put the bag in the other bag, and I walked around with a little handy-dandy plastic bag with a handle on it. And I kept that next to my chest or my waist, and that hid the tube that was coming out of my pants through my zipper or through my pajamas, and nobody could see it. And I walked around with that, real handy. It's not very handy trying to hold a plastic bag full of liquid, and I walked around with that. And nobody, I don't think my wife ever saw it, unless she snuck into the bathroom and looked at it when I was taking a shower or something. So that's the first thing you want to do. Save the people the uncomfortable situation where they have to look at your body fluids. Okay? Get a plastic bag, and immediately, upon leaving the hospital, have that bag and that tube with any excess tube coming out of your zipper, because remember it's attached at your thigh, and then you have that much, 2 to 3 feet of this tubing. Stick it in this bag, and nobody will notice it. I walked into stores with this thing. I did work around my farm on this thing, holding it around, and nobody paid any attention to it because it looked like a grocery bag or a bag that you get at a bookstore. Go to Barnes & Noble and get a Barnes & Noble piss bag to put your piss bag in, and carry it around. Nobody will pay any attention. Don't put it in a paper grocery bag. That doesn't look normal. Just put one of these things and carry it around and just keep it next to you, and nobody will ever suspect. Nobody will ever see your tube. You just roll it through your zippers and button up like that. That's what you owe the world. Nobody wants to see your big bag of piss, okay? So do that, and it's really handy because you cannot carry this. They will give you a clip or something where you can hang this bag on your belt, but, give me a break. Who in the hell wants that? Okay, now, emptying this bag, once you get out of the hospital, this bag is going to fill up over time, and a normal person will create 2 to 3 liters, I guess. I think it's 3 quarts of urine a day. Don't let the bag fill up like a balloon where it's about to burst, okay? Empty the damn thing. I let it maybe a pint or so, and then I would drain it. 2 reasons. I don't want to be carrying around 15 pounds of water in a bag. And the other is there's the worry that you might drop that damn bag. Even if you're holding it in a bag, it might drop it. It's so heavy it might jerk your tube out of you, which would be a disaster. Okay, the way you empty it is you don't have to detach it from yourself. You just walk over to a toilet, hold the bag up. Well, be careful. The bag has to be lower than the elevation of the tube coming out of your bladder, or it's not going to drain. Okay? So, well, yes and no. But just keep it down below, because when you open up the little tap on the bottom, it drains like that, just from gravity, goes right into the toilet, but also because there's a charge of water there going down, it creates a vacuum behind it up to your bladder, and it will remove any little drops of urine that are in your bladder or in the tube from your bladder down to where the one is connected to the bag. And it just empties out in a second. It's clean. It doesn't splash anywhere. You clip it again, put it back in your bag. And I would do that 5 or 6 times a day. Okay, that's what you want to do. You do not want to walk around with a gallon, which is 17 pounds of piss, like that. There was a sign. I think in the old movie Coming Home with John Voight and Jane Fonda, and he was crippled from the Vietnam War, and he had one of these bags, and Jane came to visit it, and somehow that bag got loose, and she grabbed it, and piss went everywhere. Okay, number 1, she had to look at it. Then number 2, it was so full that when she went for a grab for it, exploded and covered everybody with piss. No need for that crap. Keep it empty, just keep it every pint, 3/4 quart, empty it. Okay, and the bag doesn't really need to be washed because nothing can go in it. But what I did is when I took a shower, you detach the bag, and you have the tube hanging out of your dick, but so you get in the shower, and there'll be a few drops that are just naturally generated, and they'll drip. But at that time, you really wash yourself really good. Everything that you really wash yourself good. Wash the tube. And the bag, I got in the habit of just washing it out. I would put it on the sink or something, and I would fill it up through the tube somehow, and then I would just let it flow into the shower. There's virtually nothing in it. Or into the toilet, just to keep it clean inside. And I had mine for a couple of weeks, 2 to 3 weeks, and I never changed it. It was always clean. It wasn't an issue. Okay? So that's the deal. That's how you deal with a catheter. And the thing, if you put it in a bag and carry it around, nobody's going to see it. It's really handy. There's no chance of dropping it and pulling it away from yourself. Now, in my diary, I have the exact number of days that I had that thing. Seems to me it was about 2 to 3 weeks, and it's pretty much the same. I forget how many days. But anyway, the day that it's come out, you go see your urologist, and in my case, you go in the room, and here comes the pretty nurse again, and you pull down your pants, and you got this tube hanging out of your cock, and she somehow magically deflates that. There's something she does that deflates the bulb that's in your bladder. It goes down, and the tube comes right out. It feels like somebody's tickling you from the innards, but it just takes, I mean, it took 10 seconds, and she walks away. You pull up your pants, and away you go. Now, that's only the start of your urinary adventures, okay? I want to come back to Stanford. I was out of the hospital exactly 24 hours from when I went in. 6, 7 in the morning. They called my wife. She drove up. I jumped in the car, or I was wheeled out on a wheelchair course. And we went back to the motel, and we stayed one more day, because there we were comfortable. Didn't have to drive 5 or 6 hours over the Sierra Mountains to get back to our home. So I could rest there, get kind of used to the urine, to the bag, things like that, get in some normal clothes. And she would go out, my wife is Asian, so she would go out and get pho, which is, really nutritious, Vietnamese soups, vegetable soups. They're real easy things to eat, even though I was really hungry. We may have even got pizza at that time. I was starving, so I was fit, ready to go, but so we spent that extra day and then left the next day, and then we drove over the hill. But that's when the real adventure started. Between the pain in my side from these damn lesions, which for the first few days she had to pull me up out of a chair and help me up off of a bed simply because of the pain. But and then dealing with the urinary thing, okay, which I still am. 7 months later, I'm still dealing with the urinary thing. And I suppose I had to interject right now. You get your prostate out, you plan on 6, 7, 8 months, 12 months, and for some people, 2 years before you gain control of your urinary tract. And what I mean by that is that after the operation, there are some people who have no control. They're walking in their motel room or their home, and they just piss their pants. They have no control. That wasn't the case with me. And this is after you have your catheter removed, because until you have your catheter removed, it's not an issue. You are always empty. You're never uncomfortable. That's not a problem. But after that, what happens is that with the operation, with the removal of your prostate, you do a lot of trauma to your urinary tract, because here's your bladder here, the tube goes, your urethra goes down, and here's your prostate around it, and that gets all operated, and there's lymph nodes and nerves and everything. So there's tremendous trauma to your urethra as it enters or close to your bladder. And I am told, I haven't researched this, but I'm told that men have 3 controls on their urine flow. And in the operation, 2 were removed, and so the one that is left is one that you have never used before, and you have to go through certain physical exercises over time. I forget what the name is, kettle exercise or something like that, where you try to strengthen that, some sort of a sphincter. But I also heard that women only have 1 control on their urinary tract, which now I do because I've had 2 of them removed. And this is why women, when they have to go, they have to go. Whereas a guy, he can stand there and let it build up till he's about to explode and has some control. Women can't do that because they only have 1 control. So, one of the other advantages of being a guy in this world, other than that the whole world is your urinal, is that you have more control on your urinary tract. Okay, so once the catheter is removed, you go on pads. But prior to that, I want to tell you some other things. One thing I found out, and this is things I passed on to my urologist and to my surgeon, in which they'll never tell you. Because of the lesions that you have in your stomach, which are extremely sensitive for a few weeks, or a few of them can be, what you can't tolerate is flexing your stomach muscles. For example, coughing. You will flex your stomach muscles, your intestinal wall, and it's agony. It's like you have a broken rib. Or sneezing, or bearing down, like you have to fart. You involuntarily bear down, try to expel it, or because your stools are not loose, you bear down. You don't want to be anywhere near that. And there's a ways of alleviating it. And there's two things that saved my life, honest to God. I always carry with me, because I have a kind of a itchy throat allergy type situation, is I always carry around a little bottle of cough medicine. This is simple cough suppressant. It's not an expectorant. That, if you're just normal, if you don't have a cold or something like that, if you have an itchy throat, you've got to go like that, which is going to kill you. You just take a little sip of this thing and give it 30 seconds and it'll stop it. The other thing that saved my life was this. Gas tablets, simethicone, 20 varieties over the counter. Little tablet like that once a day or twice a day, particularly right after the operation, kept any gas buildup, any bloating. And I did not have, and let gas pass normally or was resorbed, I did not have to bear down, because bearing down even the slightest bit was agony. This, believe it or not, saved me from endless, real pain. These darn tablets. Now, concerning coughing, if you have a heavy cold, bronchitis, or anything where you have uncontrollable coughs, I would recommend above anything is you cancel that operation. Okay? You're not going to die if that operation is postponed for another 30 days or 60 days. But you will die if you come out of that operation and you have an uncontrolled cough. You're going to die from the pain, from flexing your stomach muscles around those lesions. It is going to kill you. It's going to be agony. So if you're not really well prior to your operation, say it's going to be on March 1st, and you, 2 weeks, a week out, you have a heavy cough, you have bronchitis, call in and say, I can't do it. Now, they're not going to let you into the hospital anyway if you're sick, even if you have a cold, but don't wait till the last day. You're not going to die if your operation is postponed, okay? So do it, because just save yourself a lot of pain. Postpone until your chest has healed up that you do not have any inclination at all to cough. Okay. Now, the other thing, when you, like I said before, the day before the operation, you have to clean yourself out with fleets, enemas, and things like that, which means that for the next 2 or 3 days, your bowels are going to be naturally loose. You can thank your stars that they are, because the other thing that will really ruin you is, like I said, is bearing down, trying to defecate. And the handy thing is that after the operation for 2 or 3 days, your stools are going to be loose. It's not diarrhea, but they're going to be loose, where you don't feel like doing that. But after the operation, they will naturally start to harden up, and I would recommend, and you talk to your urologist, because you're going to be seeing him right after the operation and stuff back at your hometown, is keeping your bowels loose. And that may be a daily dose of Metamucil, not a laxative, but a Metamucil, something like with Ciliminate that keeps your bowels loose. But maybe this white powder, Mucilex, whatever the hell it is, which is polyethylene glycol, happens to be the same thing as radiator fluid. Don't ask me why. But those will keep your bowels loose and not watery, but just loose. And you will thank your stars that is like that, because you, for several weeks, are not going to want to have to bear down. And you're not going to want to have to have an enema. Okay, so that's the other thing. Now, let's talk about, okay, you're out of your operation a couple of weeks, you're going to get your catheter out, so urination is not a problem till then. But then after, that's when the urinary tract adventure starts, which may be with you for 6, 8 months, year and a half, depending on your condition, 2 years potentially. But I've met guys who are 80 years old who had this 15 years ago, and after 2 years, and they weren't terribly good shape, I think they were obese, they're back to normal. It's just a matter of you have to strengthen that particular one lasting muscle, wherever the hell the thing is. It's either at a sphincter at the top of your urethra, or in the urethra, or into your dick. I don't know where the hell it is. Don't care. Until that is strengthened, you will be wearing pads. Okay? Now, one of the great things about pads is there's nothing really great about them, but one of the unintentional outcomes of this is that the mystery that has been in your mind your entire life about women's menstrual cycles and the having to wear pads and all that and how they deal with it will all disappear, and you will now have a newfound camaraderie with the female sex because you're going to be wearing pads every day, and you will soon know more about pads and all that than any woman who ever lived. Okay? So, no more mystery, which has been bedeviling me for 70 years, not wanting to talk to my wife about it or girlfriends about it. I didn't want to know anything about it. Well, now I realize that it's about hyped up about 10 times more than it should be, and it's probably equally a mystery to women as why men make such a big deal of this, that the whole culture revolves around it, at least in America. My wife is in Asia. It's not an issue at all. Okay? Nobody thinks about it, but over here is some sort of big deal in our culture with the women and their menses and how they take care of it. Well, okay, you're going to become an expert. You're going to be able to advise your teenage daughter and all this. Okay, so what do? Once you get your tube out, you have virtually no urinary control. It's going to take a while. So the first thing you're going to have to do is you go down to Walgreens or Walmart or wherever, and you go into the feminine products aisle, which have been renamed now, at least at Walgreens, as the incontinence aisle. And here's 100 feet of products for incontinence. And the first 90 feet are for women, and then or 95 feet are for women, and then squeezed in there are those for men. However, that will be expanding because as men go older, they can't hold it anyway. But the things that you need to get are three things. Okay? I'll hold them up here. Hopefully you can see them. Depends for men. And it says maximum on there, and then there's a size, small to medium. Okay, I weigh 180 pounds, and I'm 5'9". I take the small to medium. Okay? No need for industrial strength for me. This will do. This is what you need. Okay? And they're reasonably inexpensive. And they're a good product. They're what I call diapers. I'm not going to unfold this, but it's basically a men's diaper. It's got a pad on the front and it goes around to the back, to your rear end. And that's what they're for. And you're in there, and if you leak more or less, you've got a big pad in there that takes care of it. Now, for the first couple of weeks, you could change these couple times a day. Okay, you throw them away, put them in a bag. Let me talk about, again, a little bit of propriety when it comes to that too. But the other two things you got to get, or at least initially, is this. Guards. Made by Depends again. There's other products coming out. But these are guards. These are great big sanitary napkins for men. Okay, you're going to be on a period for a while, and you get these things. And I found, until I got a little bit better control, is I took one of those and I inserted it into my diaper. Now, let me show you how these things work, because there's a way here that you can potentially do yourself a fatal injury. That's what they look like. Okay? Yes, here's the top, and you're in front. That goes under your butt. Okay, just a sanitary napkin. Now, on the back of this thing is this elastic strip. See that? And what you do is take that off, and then if you press that into your diaper or later into your underwear or something, it keeps it from sliding around. I didn't even notice this the first time, and I'm walking around Home Depot, and I felt something going down my leg, and I looked down, and the damn pad is hanging out my pant leg. Thank God there was nobody around, and I grabbed it, stuffed it in my shirt, went into the bathroom, and figured out how to use the damn thing. Now, here I'm going to save your life. When you take that pad off, you've got a strip of elastic here. It's not real strong. But you're going to do this, okay? Just look forward to you're going to do it, because my wife told me every woman does it at least once. Instead of putting this thing in like that, okay, here's the outside of your pants, you put it in like this, and here's your dick, okay? You're going to do this. After you take the pad off, you're going to have, or excuse me, the strip off, you're going to have elastic this way, and you're going to wrap this thing around your dick, around your butt. And depending on how hairy you are, you're going to have an experience that you don't want to repeat, because you're going to have to peel this sucker off of your pubic hair, and one by one, and it isn't any fun at all. You can just imagine pulling this thing with elastic on here off of your pubic hair. You'll do it at least once, and I've told that women do it at least once. So when you do this, double check, put it in like this. So here's your cock here, and here's your butt down here. Don't do that, or you're going to pay for it. Okay? So that's a warning for you. Now, later on, as you get things under control a little bit, and your leakage, your natural leakage goes away, you can get away from those big thick pads, which I just showed you, and you can go to these things, which are just thinner, more akin to what women wear. And you can put those in your undies, and because there's going to be a point where you're going to be leaking very little. It took me 4 or 5 months, and I never did have a lot of lack of control, but it's 4 or 5 months, and I found that, okay, if I'm standing still like this or sitting still, I don't leak. But there's certain times if you lift your leg, or you bend over, or you twist, or something like tying your shoes, you will leak. And it's not a flood, but you will still need the pad. Now, the doctors will tell you this, and I'm going to emphasize this. Concerning foods or things that you don't want to be eating while you're trying to gain control of your urinary problems. And the main one is carbonated beverages. The doctors will tell you no carbonated beverages, no alcohol, no caffeine. Well, I'm not going to give up caffeine, so I always had a cup of instant coffee in the morning, no more. And I found out that if I drank 2 of them, later in the day, I start leaking. And out of the blue, I start leaking. That's caffeine. So I limit, and so I've always been good with one. The other is alcohol hasn't affected me much. I drink a glass or 2 of red wine in the evening. That doesn't affect me much. But boy, the one thing it will is carbonated drinks. Soda, cider, beer, carbonated wine. I will promise you, you drink that, particularly not too long after your operation in the first couple of months, and you'll piss your pants uncontrollably. The bubbles are carbon dioxide, and as they pass through your system, they irritate the hell out of your bladder, and you get this spontaneous discharge. Your bladder will expel this carbonated liquid that has made it to your bladder. And I've had friends that wasn't too long after the operation, they involuntarily just pissed their pants after having, I think it was a beer or something, or a Coca-Cola or something. Stay away from that. Be careful with your caffeine. Don't boil coffee and to the point where your spoon stands up in it. Don't do any power drinks like the power drinks, Monster, stuff like that, because they're about the drink that tall, they're about that much pure caffeine, and you're not going to want to do that either. So just take it easy. Drink red wine in moderation. Don't drink anything carbonated. That'll save you a lot of pain and agony right there. Okay. So let me see. As we're going along, you're living your life, and you've got rid of your piss bag. You're now on pads, which I am now. And my routine is when I go to bed, I put on a pair of diapers, which I don't even know why I do that. I put on a pair of diapers because I don't want to wake up with any kind of, even a few drops of urine on my pajamas or on a pair of underwear. And the other is, on my bed, from the first day I got home, we made sure we had a plastic cover over the mattress. It was actually a box spring mattress cover, which I just laid flat. I didn't wrap it around. I just used it as a sheet. Then we put our normal sheets and blankets on there. And then on where I slept, I had a big bath towel. And I still do. I fold it in half and I put it there. And when I lay down on my bed, it it covers all around me in my midsection. So if there's any chance of leakage, it's not going to make it to our sheets, and most importantly to our mattress. And it's never happened. But another preventative is I wear diapers, men's underwear here. I wear that as well because, again, I don't want to have any urine leak to my clothing. I don't want to have to wash them every day. I may not need to now, but I still do. Then when I get up and in the morning, I have found this, like every night before I go to bed, without fail, I take a shower, and that's to clean your groin area. Because one thing about these pads is that they wrap around your cog and balls, and you sweat, and you become sticky, and you smell. Not terribly, but it's very humid, and you want to, once you go in a shower every night, you want to really clean yourself up because of the humidity that caused. There's a joke that once you get off of your catheter in your bag, that for the first month you're going to smell like a restroom on the interstate, and that's about right because you are leaking urine all the time, and in your underwear or in your diapers, it's humid, and that starts to stink. This is why for the first month or so you want to change. If you're wearing your diapers, change it 2 or 3 times a day because you may not smell it, but women and dogs have much higher sensitivity to smells than we do. We can't smell a damn thing. They can smell everything. You don't want to subject them to that. Keep yourself clean every night. Take a shower. In the morning when I get up, don't tell my wife, but what I do is I can either stand in the shower or above the sink, and I take my pads off and stuff like that, and I wash my privates with just hot water, just to clean them because they get humid like that. And then I put on a new diaper, or what I've been doing now for 3 or 4 months is I just wear normal underwear and one of those pads, which I'm now down to the thin pads. That's what's going to happen. Keep yourself clean because you will start to smell because of the humidity. Now, concerning your pads and your diapers in your bathroom, get yourself a plastic bag of some sort and stuff them in there, and every day tie them up, take them outside the house and put them in your garbage. Don't put them under the sink. Don't put them in your trash can in your kitchen. Take them outside and throw them in your garbage can. Be polite to other people. Nobody wants to see your soiled diapers or your pads. They don't want to smell them. They don't want to be around them any more than you want to be around feminine products that have been soiled. Okay? Somehow, teenage girls figure out magically how to dispose of their feminine products so no man ever sees them ever for the rest of their life. They somehow disappear. I don't know how they do it, but they learn to do it as young teenage girls. You figured it out. Do the same thing for them and everybody in your family, and anybody who might be a guest at your house goes into your bathroom. Nobody wants to see anything like that. I have my bags like this on the floor in the corner of my bathroom, all stacked up kind of neatly, and I have a plastic bag there. You can't see through it or anything, and I put my pads and stuff in there, and then every evening or in the morning I tie it up and I dispose of it outside, put a new one in there. That's how I do it. Okay? Or you could even have a child's diaper pail or something like that. But again, the stuff smells. So it's easier just to dispose of it every day. And just throw it away. Or keep your plastic bag under the sink and then put your pads and stuff there. Okay? So where am I now? So we're going along, and what's going to happen is naturally the trauma that had been inflicted upon your urinary tract in there by removal of your prostate is going to ease up, and you're going to find naturally you're going to have a little bit better control all the time. And I suspect about June of next year, which will be a year and a month after I had my operation, that I should have full control. All right, at that time, I'm looking forward to having intimate relations again with my beautiful wife. So what does this mean? It means that after your prostate, you have no seminal fluid. Okay? When you ejaculate, it'll be dry. You can get, and again, this is generally, there are people who are really damaged, people who never recover, people who have to have penile implants. Okay, but I'm just a normal guy and I'm fit. Okay? And I think that's what's going to happen to most of you guys. So no matter what your age, you know, a lot of you fellas, you're going to have this is going to happen to you in your 50s. And now I want to mention one thing. A lot of you guys along the way are going to, and I forget what the medical term is, but in effect, what your prostate does start to swell. It's not cancerous, precancerous, but it starts to squeeze your urethra, so you have problems urinating. And I've got a friend, he's 80, he gets up 6 times a night, and it is very painful for him to urinate. It just disrupts his life completely. And I had another friend that happened to. He was in his mid-70s, dead now. But a couple of my friends who have had this, you know, and that's the normal thing, and there's a very common term for it, something about prostatitis loss or something, where it squeezes, but it has nothing to do with cancer. It's just, okay, very normal. Well, a couple of my friends have had this, and they went for a procedure which they called Roto-Rooter, which I don't think is the medical term for it, but they had something gone up their cock and opened things up and somehow relieve that. You can look it up. Gives me the willies to even think about it. I don't want to think about anything going up my cock. But anyway, and it relieved them. And then they could urinate naturally. And they said it was the most wonderful thing in the world. Didn't take very long. And they had suffered through stress urination for years. And so they called it getting roto-rootered. I think your urologist will probably have a more medical term for it. But anyway, remember that. Not necessarily cancer. But what happens, which happened to me, which will happen to you if you get your prostate out, is that the seminal fluid, which is your ejaculate, is gone. You can still have an orgasm, I have found out. I can have one now. All I have to do is think of the appropriate pornography and really stimulate myself. And you only do this in the shower, and I'll tell you why. You can have a pretty darn intense orgasm, particularly if you have been out, you haven't had any sexual relations for 6 months, and you got it all built up in you, and it doesn't take much. So that's a great thing, because theoretically down the way, when you have full urinary control, you can take Cialis or something like that, which I did, and it works. Now, realize that your whole system has been traumatized, and your size of your dick is going to go from its natural 8 inches down to 4, or whatever size suits you. You're going to lose a lot of blood flow to your dick, and getting an erection is going to be really tough, really tough. And it's very disappointing to you. It's going to be disappointing to your wife. Cialis will help, okay? Or Cialis, that type of medicine. It'll help. But the days of being the stud is maybe over. But it doesn't mean you can't have an orgasm. But I have to be very clear. Until you have full control of your urinary tract, where there is no leakage, be very careful. Because when you orgasm, you're going to expel. There's going to be an ejaculate. But it's not semen or seminal fluid. It's going to be urine. Okay? Yeah, you're going to do what you might call a male squirt. It's going to be urine. So be careful until you have full control. Careful what your intimate relationships are with your wife. Okay? I don't need to elaborate on that. Just be careful and be considerate. But what I found out is that because you don't have control, your bladder will always have urine in it. Your urinary tract will always have some urine in it. And when you orgasm, it will be expelled. If you, and I do this in the shower because you don't have much control, but if your bladder is full, it's going to be spectacular. You say, hey, I've got a place in the porn world. It's basically male squirting, except it's not exactly, because in female squirting, what is squirted is generally clear fluid. It is only some minor part of it is urine. What happens is a woman's bladder will fill with clear liquid, clear water, and that is it. But there'll be some urine in it. In a man, that's not the case. The only thing that's going to come out is urine. And potentially you could completely eliminate, take a leak and try to clean it, get everything out, and then play with your wife or something like that, but don't count on it because urine is continuously generated. And if you have an orgasm, you're going to expel a certain amount of urine. It's really unfortunate. So I'm looking forward. So one thing, you can get an orgasm. You can feel like you are ejaculating, but it's not. What the normal thing is, it's going to be urine until you have full control of your urinary tract. Thereafter, it will be dry, but it'll be pretty sensational. You're not going to cry that you do not have an ejaculate. Okay? So, and if in terms of getting an erection or even a semi-erection, there are things like Cialis and stuff like that will basically direct the blood to your cock where it can be made larger. That's what gives you an erection. So I'm not there yet. I'm looking for hopefully another 6 months. And in the interim, they give you what they call kettle exercise or something like that, where basically you flex the muscles around your groin. You do it in a way that you do not overdo it and flex the muscles in your stomach. My urologist told me, you do it as hard as you can for 30 seconds and you do it 10 times. No, that's not correct. You do not do this as hard as you can. You do it only it's kind of like feeling if you're trying to keep a fart from being expelled, like closing the sphincter on your rear end, but you're basically trying to close your dick. And you're working on that muscle. And you don't overdo it. You only do that much. You do not do it so hard that you're feeling like you're flexing your stomach muscles. Very important. And you do that 10 times a day, 30 seconds off, 30 seconds rest, 10 times a day. It's really difficult to get into that habit, believe me. I find if I'm driving, I do it then. But that's the one thing that will, I think in terms of naturally, it will eventually, it could take 2 years to remedy itself on its own. But before that, do this, and that will speed up the process. Okay, what else am I thinking about? I'm trying to think of anything else. So I'm halfway. I had my operation 7 months ago. I'm hoping by the next 6 months I'm back on track. I don't have to wear pads or anything. And I can get back to having normal relationships with my wife. And it's really not an inconvenience. It's just like anything. Okay, you think that I'd rather die than wear a catheter. Well, after about 2 days, you don't even notice it. You adjust yourself. And the same as wearing pads, wearing diapers. You just get used to it, and you say, I'm going to man up. It's not going to last forever. 6 months from now, 12 months from now, I'm going to be back and back to my normal self. And that's correct, because I've talked with guys who have had it done, and after a year or two, depending upon their physical condition and thing, everybody's a little bit different. Some people respond pretty quickly. They're back to normal. Forgot about all that happened. No more cancer. Okay? Now, finally, I'm trying to think that I'm saying everything here. When I had which will happen to you, if you have your prostate out, they're going to take a little bit of the lymph nodes around it, and they're going to do biopsies on that, and they're going to see if there's any cancer spread around it. In my case, they came back and they found the lymph nodes directly around the prostate, which is that big. There was some cancer cells. Okay, I went back and had a PSA done, and it came back at 0.7. It should have come back as 0.0. So I still had some residual cancer in there. So the procedure was, and this started about 3 months ago, I'm on Medicare and I have good secondary insurance, Blue Cross, Anthem Blue Cross. Okay, this would be a killer if you didn't have Medicare or less really good company insurance or something. Well, the procedure was, okay, now I have to go in for radiation. There was two things that I was told I would have to do. One is radiation. Number two, at the same time, is what they call hormone therapy, which is where they give you a series of injections which basically eliminate all the testosterone in your body. And I'm sure a lot of you have heard of this. All right, what it does is kill the testosterone, which is the hormone that feeds cancers of all type. It doesn't kill the cancer, doesn't eliminate it, but it quits feeding it. And you can live for some time. If you're not feeding your cancer, it can still be there, but it's in stasis. Okay, well, I was told about this, and I didn't look forward to this at all. Thankfully, when I went to see my oncology radiologist, and my last shot was yesterday, or my last radiation was yesterday, he says, nope, and here's across the street from my urologist, who said, yes, you have to do that. I go across the street down to another specialist, my radiologist, oncologist, and he says, no, we don't do that anymore. Okay, so check around. If your local yokel doctor says you got to have it, phone around, because you don't want to do that. It's debilitating. It's debilitating, the hormone treatment. I'll explain what that is in a minute. Anyway, so what I did is I went for a full body PET scan. They give you an injection that highlights any place in your body that is giving off PSA. Pretty amazing. You go in there and they do a full PET scan on you. I saw the bill. It was $12,000, which went to Medicare and secondary insurance. I never saw a book for it. And they look for any spot on your body, head to toe, that appears to be generating PSA, which might be one of these cancer cells that leaped over your shoulder or leaped up to your nose or something, and then they treat that. And so they couldn't find any. It was pinpoint, so small, they assume it is in the lymph nodes around my prostate. So they scheduled me for 40 treatments, 5 days a week for a little over 2 months. And every morning, the last day was yesterday, I got up at 5 in the morning and I drove for an hour and 10 minutes to get to the hospital because I live out in the country, south of Reno. Went to there and they have a big apparatus that gives you the thing that swings around. It's not a circular thing, it's just a great big round thing in it. And you go in there a couple of times first. One is they take a bunch of scans of your midsection to figure out the size, orientation, everything like that. But they can design the radiation very, very specifically because it's down to a couple of millimeters. And you go to another in the same building, a nice young lady puts you on the table, pulls your pants down below your pubic bone, and which I'll tell you right now, do them a courtesy and shave your pubic hair above your cock, for they don't have to deal with that. And she lays you down and just lines you up on a couple of lasers across your midsection, and she puts 3 little tattoos, 2 on your hips and 1 right above your pubic bone. And that is how they line up when you do go to treatment. That's how they line you up on the table. They have lasers that cross the room this way, and they put you on a table, raise it up, wiggle you around, and within 30 seconds, these gals are really sharp, they've got you lined in within a millimeter. And then you have about 10 minutes of radiation, which is designed specifically for you based on your weight, your physiology, your dosage requirements. Everything is done by a radiophysiologist or physicist, and your oncologist. You get that signed up. You get that all fixed up, then you start Monday through Friday for about 2 months. You go in and you lay on the table for 10 minutes, and this thing goes over here and zaps you, and then it like that, and it zaps you, goes under the table and zaps you, and it's just into a little horseshoe area. Okay, you don't feel a damn thing, not a damn thing. There's no secondary thing except after about 3 weeks, after the first 15, 20 doses, it does start to affect you. And what it does, it affects your bowel movements. Apparently, the radiation produces chemical reactions. So it's like because your body's being shocked, give off a few chemicals that start to mess up with your bowel movements. It doesn't affect your urinary tract so much, although I understand that some people it does. It makes them leak a little bit more and kind of sets them back on their exercises. So in effect, for those 8 weeks or 9 weeks that you're doing this, you're not going to make much progress on your urinary control. But as soon as you stop, you're on your way again. Anyway, what I found out, and they told me this, after about 3 weeks, all of a sudden your regular bowel movements get screwed up, and you go into a point where you're sort of semi-constipated all the time. And what has happened is that these chemicals have screwed up the natural peristaltic action like that in your bowels that expel your feces. And your feces just sit there. And so what you need to do, which I told my doctors, which is my experience, at that point I started taking something that kept my bowels really loose, right? I didn't have to strain, because you only have to strain trying to get this stuff out a couple of days before you create a hemorrhoid, an external or internal hemorrhoid, and then you got another big problem. I tried to keep my bowels loose, my feces loose for they came out, but the days of taking a dump in the morning where you empty out from here and that's gone until you get past radiation. You're gonna find you're gonna be a little bit crampy, you're gonna be gassy, you're gonna have to sit on the can about 4 times a day to try to get this stuff out a little bit at a time. But go for keeping your bowels loose with Metamucil or something like that. Don't take laxatives that are too harsh. Take something like or a stool softener. That's okay. Try to your biggest goal is try not to generate hemorrhoids. Okay, and then and I also found taking the magic pills helps too, because you'll be generating gas, which makes you crampy, bloated, very uncomfortable. I take those suckers once or twice a day. I always take one before I go to bed, because I found if I'm gassy at night and I feel like I have to discharge a fart or something, it keeps me awake. So I have found from the first day after the surgery, I take one of these like a vitamin every night before I go to bed, and that allows me to sleep. Well, anyway, after the radiation, you're 3 weeks or so, you're going to be dealing with gas and some minor cramps. This will help you a lot. Now, yesterday was my last day. I went back for my last time. I bought beautiful bouquets for the 4 nurses there who took such good care of me, who were so professional all the time, and said goodbye to my doctor, my radiologist, oncologist, and I'm back home. And now I can sleep until 7 in the morning instead of having to get up at 5 in the morning. And I'm hoping within a week my bowel movements are back to normal. Okay. One last thing, hormone treatment. I haven't had it done, but a couple of friends of mine have. What happens is that they eliminate the testosterone in your body, which is basically a poison, and in effect, it's food for cancer. And they give you an injection, and that injection, there might be 2 of them or something, it lasts for about 6 months. And in that time, you're going to go through male menopause. It isn't any fun. You're going to have fatigue, man boobs, and the worst of all, hot flashes. The hot flashes are what really are really tough on a lot of men, because they're often very unpleasant, really unpleasant. Now, a friend of mine, he's 78, and he's kind of obese. He's not in real good shape. He complained like hell about the hot flashes, so they gave him a medication for that, and that made it worse. It just gave him terrible fatigue, and he finally had to quit that. He just had to deal with the hot flashes, and he said, no more treatments like this. I don't care if I die. But he was on them for 6 or 8 months. In his case, he did not have prostate. He had a tumor on the back of his prostate, which they injected with radioactive pellets. He never had an operation, but they wanted to eliminate that cancer in conjunction with the pellets, and so they gave him this hormone treatment. Now, that's all I know about it. It isn't any fun. It's fatiguing, hot flashes and things like that. I don't think your voice is going to go up an octave, but very unpleasant. Now, but, you know, you can deal with it. Now, I've also heard of a guy who was kind of a fitness guy. He went to the gym every day. And because of his really, continuous physical exercise, that this hormone treatment didn't bother him much. He did have some hot flashes, but the fatigue and the general feeling of not being really up to anything, that went through him. He just dealt with it. But he was an exercise type guy and kept himself fit, rode a bicycle and stuff. So physical exercise can apparently alleviate some of the hot or the other factors that make you uncomfortable. And finally, I asked my radiologist, I said, if this radiation doesn't kill the cancer, do I have to do the hormone? And he says, I don't expect to see, even if the cancer comes back a little bit, in which this will be tested with a PSA every 6 months. I'll have my first PSA post-radiation here in about a month. If it comes back, it'll probably not be for 5 years. And if we do, by that time, there's not going to be any more hormone treatment. They're coming out with immuno-designed drugs that go strictly for immune reaction things, not hormone. They go directly for this particular types of cancers. And he says, by the time I ever see you, which is unlikely, because the radiation is 80% effective. He's told me that over and over again. You're a fit guy. You don't have any other problems with you that will bring down your immune system or anything. I don't expect to see you. 80% chance I'll never see you. But if you ever do come back, it's going to be some years from now. And at that point, there's no more hormone therapy. There's going to be these immunotherapy drugs, which I'm sure is not the correct way of saying it. But there'll be things specific where they're not taking all the testosterone out of you, which is the death knell for any sex life you ever thought you might have. Testosterone is what gives you the ability to be aroused, to orgasm. You take your testosterone away, you're just a eunuch walking around. So hopefully by the time any of you guys ever have to have this done, and if that comes up, they'll have something better for you than which is now very effective, but it is not what you want. It doesn't cure the cancer, it just puts it in stasis. So that's it, guys. I hope I've given you some information that the doctors won't. I've seen other YouTube videos on here, and there's always a nice guy dressed in a doctor's office, but down in the corner there's some emblem from some medical service, and they're giving you all kinds of hot information, but in effect they're salesmen. I'm sure what they're telling you is great, but you're not seeing any blue-collar guy like me who's gone through this talk to you. At least I haven't seen. Even though I'm a white-collar guy, I'm a scientist, I'm a geologist, but I'm also a blue-collar guy because I have a farm here I have to take care of. So 90% of the time I'm working with my hands. So I'm just a regular guy who's done this. And I've looked for things to alleviate my pain, my intestinal distress, stool problems and gas problems and things like that, and best pads and how to keep the night. That's all I'm trying to give you, because your loved ones are they're going to worry terribly about you. But do them a favor, don't expose them to soiled pads, diapers, things like this, particularly urine bags. Keep it in a bag, be polite, and that will make their life much nicer. It'll be much nicer to be around you. And but the main thing is removing your prostate is not a big deal. It's not a big deal. It's not painful. It's the radiation treatments. It's nothing like the treatments that, radiation treatments for neck, throat cancers, esophageal cancers, all these other terrible things that unfortunate people have. This is really pretty small because it's a spot that big down in your groin that they're zapping away. They're not doing full body radiation or major radiation. You're not getting chemical treatments, anything. It's not that type of cancer. Nothing like, many other cancers that require injections and chemotherapy and all these things that are very, very unpleasant. It's nothing like this. This will be the easiest cancer that you ever had taken care of, except maybe skin cancers. So I can't think of anything more I just hope you guys, if you like my video and it's helped you, just give me a like or something like that. I don't have to do this, but I've just gone through it, and I found there's a whole bunch of little things that my doctor didn't tell me, which is really not their business. This is something you learn. And I have fed a lot of the same things back to my doctors, my surgeon. They've appreciated it. They've told me they've appreciated it. And to my nurses, because their job too is to make you as a patient as comfortable as you can and ease your way through this. And so they've appreciated the little insights that I've come up with. So hope things go for you. And if you guys have to go through have to go through what I did, be optimistic, take care of yourself, don't abuse yourself, don't hurry yourself, don't come out of don't order a pizza and lasagna and beer the day after you get out of the operation. Treat yourself well, for you don't upset another part of your system and just keep yourself miserable. There's no reason to do that. Treat yourself well. Okay, fellas, good luck to you. Thank you.